Hi everybody. Today I'm going to talk to you about a topic which very often many of my patients in my outpatient clinic ask me about: lumbar spine surgeries. Hi, I'm Dr. Satish Babu. I'm a consultant neurosurgeon practicing in Bangalore at the Brain and Spine Intervention Clinic. Today I'm going to talk to you about the endoscopic spine surgery for lumbar disc prolapse. Very often in the clinic we come across patients with severe back pain and leg pain, and most often when we advise surgery for them, they ask if it's going to be a minimally invasive daycare procedure or is it going to involve a long hospital stay. Well, to answer this question, it's very important to note that the lumbar spine problems present in various ways. They may present with a severe back pain alone, or it may be presented in the form of a severe pain or numbness or paresthesias in the lower limbs, or a combination of both. Every patient who presents to us with severe back pain and leg pain are subjected to CT scans, sometimes X-rays, the dynamic X-rays, to see if there's any instability, and an MRI scan of the lumbar spine. Following these investigations, we come to a conclusion as to whether the patient is suffering from a problem which needs surgery or a medical line of management. Very often, a combination of medications, physiotherapy, wearing a lumbar belt, and taking bed rest solves the issue. However, a significant fraction of the patients need a surgical procedure. Sometimes before we subject them to a spine surgery, we advise them to undergo epidural or transforaminal injections to reduce the pain. The usual surgical procedures that are carried on involve the removal of a significant part of the spine bone, which used to be usually the standard laminectomy, wherein a portion of the spine is removed and then the disc space is entered and the disc is removed. Later on, we used to do limited laminectomies where only a small portion of it was removed. And as days passed by, when the microscopic discectomies arrived, a very small portion of the bone was removed and less than 5 centimeters incision was done, and the hospital stay became shorter and the dissection of the muscles became lesser and the pain became tolerable, and the patient is to get out of the hospital in a couple of days. Of late, the lumbar endoscopic spine surgery has made the size of the incision much smaller, almost the size of a buttonhole or less than 2 centimeters, and the amount of dissection of the muscle is negligible, and the procedure is usually carried as an outpatient, or overnight the patient is asked to stay, and the relief is very obvious by the time the patient is discharged, and generally the patient can get back to his normal activities of life maybe the very next day or in a couple of days. A word of caution and advice is that every patient would want the surgical procedure to be as short as possible and less painful. But you must remember that all lumbar disc problems are not treated by the endoscopic surgery. Even now, there is scope for microlumbar discectomy, and every patient has to be examined and the clinical details have to be analyzed, and the MRI findings have to be collaborated with the clinical finding in the patient, and then a decision whether to subject the patient to a lumbar discectomy or no is done. So if you are walking into the clinic with a back pain and you have a lumbar disc problem, don't think that every time is going to be treated with the endoscopic surgery. So it's important for you to consult your nearest neurosurgeon, have a discussion with him, and then know the pros and cons of being operated, and then subject yourself to surgery. These two equipments are the two vital parts of the endoscopic system, where the smaller one is the channel through which the endoscope and the light source passes through, along with the instruments that are used to do the surgery on the spine through a small keyhole opening. These are the fine equipments that are used successively through the working channel with the endoscope as the guiding force and the light source and the camera showing us where we are. The disc material and the offending ligaments or any soft tissue that is pressing onto the nerve is removed piecemeal so that the nerve roots are free at the end of the surgery through the keyhole. This is the endoscope that's used to do the endoscopic lumbar discectomy, and this is generally approached through a small buttonhole incision which will guide us to enter into the disc space. So you can notice that this is the hole through which the nerve roots arise, and this is where the disc would be, and this is how the thing would be approached, and the disc material that is compressing on the nerve is removed, and the nerve root is free. At the Brain and Spine Intervention Clinic, the consultations for all patients who have low backache is open. You can walk in with your queries along with your reports and have a detailed discussion with me, and we could chart out a program and try and avoid surgery as much as possible with non-surgical kind of treatment. But if it's really necessary, we could decide whether you are a candidate for a microscopic lumbar discectomy or an endoscopic lumbar discectomy. Thank you.